with the summons of the meeting. You're hereby summoned to attend the monthly meeting of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, Derry Road, Strabane, on Thursday, the 11th of December 2025 at 4 p.m. So just moving to attendance, Alderman McMorris.
Here, Karen.
Alderman Montgomery.
Online.
Apologies from Alderman Wilkinson. Councillor Lillian Bauer. Councillor Raymond Bauer. We have apologies from Councillor Boggs. Councillor Clark. Councillor Devine.
And Shaw.
Councillor Duffy is online. Councillor Hutton.
And Shaw.
Councillor McDade. Councillor O'Farrell. Okay, and Councillor Tierney. Apologies. Okay, thank you, members.
Members and guests, I'll read the broadcasting statement. I would like to remind everyone present at this meeting in the chamber or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you're consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council's privacy notice may be found on the Council's website. Thank you very much. So, members, declarations of interest, we can do that now or we can do it as we go along, working through the agenda. Is that okay? Councillor McDade?
Item 28, confidential.
Thank you, Catherine. And we will move on to agenda item 5. And just to note that this is the last Health and Community Committee meeting for 2025. So hopefully we continue to do great work in the new year. So, folks, I would like everyone to give a warm welcome to our deputation members today. And we will be hearing from David Tumulty from the Health and Social Wellbeing. He's the Improvement Manager there with Public Health Agency. And Edel O'Doherty, who's no stranger to the Chamber. And Edel's the Chief Executive of Developing Healthy Cities. So we're going to hear a wee bit about the whole system's approach to healthier weight. So Edel and David, whenever you're ready, go ahead and you will have assistance from the tech person at the back of the room for the presentation. Thank you.
Yeah, thank you very much. Good afternoon, members, and I really appreciate you giving me the opportunity to come along today to talk about the work that we've been leading within the Public Health Agency, but in collaboration with our partners across Northern Ireland and specifically across Derry City and Strabane District Council. So I'm David Tumulty, Health and Social Wellbeing Improvement Senior Manager within the Public Health Agency. And today I'm going to take you a bit of a whistle stop. Normally takes about 30 minutes to go through this presentation, but I've got about 10 or so. Yeah. So I'll try and take you through the detail quickly, but trying to make it make sense for you. So it's really about implementing a whole systems approach in Northern Ireland, and we're referring to that in the terms healthier systems for healthier weight. And that's the title that we've kind of evolved through working with people with lived experience of obesity, which is a really important factor in the work that we're doing. Next slide, please. So I'm going to play a little video here, give you a really good flavour of what we mean by whole systems. So you can sit back, take in what this does and what this is saying, and then I'll take you through the rest of the presentation. It'll take about 3 minutes altogether.
Overweight and obesity is one of the biggest public health challenges in Northern Ireland. Around 1 in 5 children and more than half of adults live with overweight and obesity. These numbers reflect real lives shaped by the places we live, the support we receive, and the opportunities available. High levels of obesity across the UK are often the result of environments that do not support people's health. When communities face barriers to affordable nutritious food, safe places to be active, or the right kind of support, health suffers. People from vulnerable groups are more affected, and inequalities means that people can be most impacted based on a range of factors. For example, where they are born or live, their ethnicity, or their employment opportunities. That is why we need a different approach, one that focuses on creating better environments and stronger systems so everyone has a chance to live well. A regional framework for action was launched in 2012. Its aim was to improve health by bringing councils, communities and organisations together to strengthen local environments and supports. No single action can solve obesity, but when we work across whole systems, real change is possible. This model is based on worldwide evidence and successful work in England and is now being developed across Northern Ireland. So, what is a whole systems approach? It's a way of working that looks at the bigger picture and builds solutions step by step with community needs in mind. Local councils across Northern Ireland have already rolled up their sleeves. They've been building partnerships, listening to residents and looking closely at what's already working in their areas. Together, with local groups and people with lived experience, they've mapped out the real factors shaping obesity, from food in shops to safe places for activity. Through community planning in each council area, partners are working together to draw up practical action plans to consider what system changes are required to support people to live well and address this important public health issue. To help shape these action plans and to get this right, we need everyone. Schools, health services, community groups, local planners, councils, government departments, to all come together to identify the causes and effects associated with this work, allowing us to implement system changes that will support people to live well. For example, safe walking and cycling infrastructure, policy and legislative development regarding food, nutrition and physical activity, and supportive environments that could improve access to opportunities to live well. The whole systems approach isn't just a strategy, it's a shared opportunity to make our environment healthier and fairer for everyone. To learn more, get involved or explore your local area's work on obesity prevention, please get in touch.
Next slide, please. So that'll give you a really good flavour.
Overweight and obesity.
That'll give you a really good flavour of, in a nutshell, over 3 minutes, as to why we need to work across the system in collaboration. But what's the rationale for this work within Derry City and Strabane specifically? So in the pack that was sent out with the papers for today, you should have received a profile for Derry City and Strabane around obesity, physical activity, nutrition. And what that really details is the context of Derry City and Strabane in relation to the rest of Northern Ireland. And whilst rates of obesity, overweight, levels of physical activity, etc., are quite stark, whenever you look at the statistical profile for Northern Ireland, Derry City and Strabane are often worse off for the majority of the factors that are contained within the profile. So it's really important that we put a lens on Derry City and Strabane and try and drive this work forward for the population and the needs that they have. We've also got the inclusive strategic growth plan within the city, and it's essential. A key component of that is trying to drive forward work in relation to obesity prevention and whole systems. So putting those two things together in terms of statistics and the growth plan itself, as well as all the evidence that surrounds itself around how to reduce chronic conditions, etc., for our population is really, really key and important. Next slide, please. So having looked at the video and working through the Public Health Agency, we've adopted a systematic approach to this work. Public Health England produced guidance on whole systems approach to obesity, and we have taken that and we're driving it forward within early adopter sites in line with community planning across each council within Northern Ireland that has signed up to take part. So what you'll see on the screen is the cyclic process that we're following. And the first step in that process is all about setup. So that's about gaining senior level support and buy-in. And we'll plug this in community planning because we want community planning to drive this through collaborative gain, where we have all the statutory partners around the table, all pulling in the same direction, working to an agenda with stretch goals, trying to drive rates of overweight and obesity, increased levels of physical activity, etc., in the right direction. Once we move through phase one and go through that cyclic motion, it's then all about building the local picture at that local level from intelligence from local people. And then we'll move into mapping the local system. What are all the causes and effects of obesity? Before we move into a phase where it's all about action. What are the actions that we want to put in place? And importantly, what are those actions in relation to system change? It's not just interventions that we want to put in place, as important as they are. System changes that are going to support people in our population be able to live healthier and adopt better and healthier behaviours in relation to overall health, but in particular around physical activity, obesity, healthy eating, etc. And then it's about managing that system network. So we can look at that and we can learn from things that are happening as we drive forward with our actions. The system evolves. We're going to have to evolve with it. So we'll have to manage that network as we drive forward. So this isn't a piece of work that's going to last for 6 months. It's going to last for years to come. This is systemic change. And then finally, reflecting and refreshing and doing that with our partners on board as well. Next slide, please. So what you'll see here is kind of the step one. We have developed a structural buy-in from the Strategic Growth Partnership aligned to community planning. I know it's quite hard to see on the screen because it's small, but hopefully you can make sense of it. We have a leadership group that has been set up, and that leadership group meets very regularly. Initially it was weekly, moving to fortnightly, nightly, and now monthly, where we get together and we try and run through all the steps that are contained within the guidance from Public Health England that we have adopted. We then identified a work stream group, and that work stream group comes through the local growth partnerships and the neighbourhood health improvement partnerships, where we bring kind of the arms and the legs to the table, where we need them to reach out and help us and gain support at that community level. But as you move over to the left-hand side of the screen, what you'll see is the connection then back to the regional picture. So the PHA lead the Regional Obesity Prevention Implementation Group, and we're tasked by the department to drive forward on strategy actions. And that then feeds its way up into OPSG, which is a departmental level body that oversees the work of obesity within Northern Ireland. We've also got a task and finish group within ROPIG underneath the PHA's responsibility. And that group, there's a group in there, task and finish, to kind of oversee the implementation of this work as we move forward and putting the lens of expertise on that as well. So it's really about taking the regional picture down into local and having a two-way process so we can actually learn from each other as we move forward. Next slide, please. So when you move from phase 1 into phase 2 and you've got that governance and that buy-in from senior level and membership from community planning, phase 2 is quite bulky. So what we need to do is we need to build that local picture, and there's lots in that local picture. So what you'll see here is, first thing we need to do is we need to train the leadership group and the work stream group in what are whole systems approaches. So we put training in place for those groups and teach them what we mean by whole system from start to finish. We then, with those groups, look at action mapping, and I'm going to touch on these in the next series of slides, so I won't spend too much time here. We'll look at asset mapping and hazards, we'll look at strategy mapping, and then a wee bit of network analysis. Next slide, please. So here, I just want to kind of flag this before we go into the action mapping, but whenever we think about health, often people think about behaviours and finish it at that. Or sometimes people think about health and think, well, let's go to the hospital and they'll sort us out and then we can go home. But as Michael Marmot first once said, you know, what's the point in bringing people into a place, treating them and sending them back to conditions that first made them sick in the first place? So this, on the left-hand side, what this is really highlighting is all of the factors that have an impact on our health. It's not just about becoming unwell and getting fixed in hospital and going back home. It's not just about our health behaviours. It's much wider than that. It's about the environments that surround us. It's about our housing, our education, our disposable income, you know, et cetera, and that's kind of described within that schematic on the left-hand side. Whenever you look at the right-hand side of the screen then, what this shows is the wider determinants, but they're split into different sections. So you'll see the biological factors, individual lifestyle factors, right up into wider conditions. And these have been mapped across by Public Health England in relation to the impacting factors that have an impact on overweight and obesity. And I'll touch on these as I go through the rest of the presentation. Next slide, please. So what you'll see here, just quickly, Public Health England have identified 226 causes of obesity. And whenever you map them against the different wider determinants of health, you'll see the linkages then in the red to the biological, the amber in terms of individual lifestyle factors and behaviours, et cetera. So it's important to try and start drawing the connections in and out of the wider determinants piece in relation to not just changing behaviours. Next slide, please. This then is where we get into looking at how we map actions that are currently, or interventions that are happening within Derry City and Strabane. Now, this slide isn't specific to Derry City and Strabane, it's just an example. So what you'll see here is the red bars show you the factors that have been identified by Public Health England, which are causes of obesity. You'll see they're mapped against the wider determinants in the sort of rainbow colours. And then on the right-hand side, in green bars coming across to meet the red bars, those are the actions that are currently organised, operating within that local area. So we need to build this in our local picture. What actions, what interventions have we got in our locality? And that's a piece of work that we'll do within phase 2. Next slide, please. We then look at asset mapping and hazard mapping. So we use GIS through a system called ARC. And what that's about, it's about identifying all the things that are either an asset or a hazard in relation to overweight and obesity. So that might be a green space, a play park, a leisure centre, a GP practice, a pharmacy, etc. But it also may be a fast food outlet or something else has a detrimental impact on overweight and obesity. So we map that all out and have it in the background for us to use at a later point in time whenever we get to the later stages of our work within whole systems. Next slide, please. And then we'll look at strategy mapping. And this is important because this garners support, allows us to influence different government departments to come on board and realise that, do you know what? Overweight and obesity is a part of our agenda as well. So we map strategy. Now this shows you again back to the wider determinants of health, how we map strategy across all the different government departments. Now they're not all on this screen, but we have done that mapping exercise. Just flick on the next slide for me, please, Colette. So what you'll see here is how we've mapped strategy across in the Department of Health. So you'll see there, what is the strategy? There's a hyperlink to it. There's a vision then within that strategy. But what are the links to obesity within that strategy? And whenever we're going to speak to these departments, we can talk to them about the linkages in and out and have that support from them. The tiles on the right-hand side just sort of highlight the key component parts and the linkages between their strategy and the wider determinants that link back to obesity. So you'll see there from poverty right through to behaviours and age in terms of biological factors. Next slide, please. And we've done that for every government department. We then move into phase 3. Phase 3 is all about mapping the system. So what does that mean? It means looking at, okay, how do we actually identify all the things that are important in relation to overweight and obesity? So in phase 2, I should have said that we identify a network analysis. So that's really who are the stakeholders that need to be involved, and the stakeholders that need to be involved then help us map this system. Those stakeholders come together, sit down, and the work to date has been led by Queen's University. So we've commissioned them to come in and support us, their expertise within systems mapping, and we draw all this together and say, okay, what are the cause and effect relationships? What are the unintended consequences? And this is quite complex, so I'm not going to try and describe it in the next couple of minutes. But ultimately, that map allows us to see all the connections between the impacting factors, the beneficial factors, and try and work out where do we actually need to make change. And then you link that back to your phase 2 stuff, which is all about what you've mapped. And when you do that, what you then start to understand is where are the gaps? And where do we want to place our energy? And where's our money and resource for us to be able to put our shoulder behind the wheel and get things to happen? Next slide, please. And once we've done the phase 3 mapping, the next steps then, as I said earlier, it's moving through into the action planning and using the action scales model. So it's a model that's been developed, and that's really about, and this is an important factor, a lot of the time whenever we map things, and my experience of working on this for the last couple of years through different early adopter sites, people tend to focus on intervention. They tend to focus on, can we have a wee scheme about this or a wee scheme about that? And whilst that's really important, and we have loads of those running across the country and in Derry, St. Serban, we need to do more. Rates of overweight and obesity are continuing to increase. You'll have seen that within the most recent Northern Ireland Health Survey. The action scales model looks at events, which is your intervention, but it also looks at structures, it looks at goals, and it looks at beliefs. How do we change beliefs for people to start to understand we actually need to take this to the next level? We need to make system changes, but what are those system changes and how do we work together to make those system changes? So it's a really complex piece of work, a really important piece of work, and I'm really, I suppose, energetic about trying to drive this forward across Northern Ireland and specifically within Derry, St. Serban based on the statistical profile versus the Northern Ireland average. Next slide, please. So just to sort of conclude, just wanted to say that the effect of collective actions is greater, far greater than the sum of individual actions. And if we can do this in collaboration and work together, I think we've got a much better chance of success moving forward. Thank you.
No, David really is the expert in the whole systems approach to healthier weight. Developing Healthy Communities are on the leadership group along with the council and Ulster University and the Health Improvement Department of the Western Trust. And we're really at the early stages. We're only at phase 2 where we will be undertaking training in the next few months. So We're just embarking on this journey, but the statistics speak for themselves, and it's 27% of the population within Derry City and Strabane are obese, and up to 65% are either obese or overweight. And all that has implications for other chronic illnesses such as diabetes, heart disease, cancers, etc. So it's a public health responsibility for all of us. And we need to get involved. All the different sectors need to get involved to try and do their bit to make the contribution to improving the health outcomes of our people. I met this morning with one of the senior officers from the youth service, and we were talking about fizzy drinks and ultra processed foods and the what we call the commercial determinants of health. I think very aggressive marketing of unhealthy foods and junk foods and fizzy drinks to our young people, which is basically shoring up on health for the next generation. So like that's one sector we will be looking to work with, but there's many, many other sectors. But I think it's important to say that there's a huge amount of great work going on in Derry City and Strabane with initiatives like the Acorn Farm and like so much work going on at community level. At the minute, we have a group working on pre-diabetes and supporting people who are on that kind of trajectory towards diabetes and trying to prevent that. Got the Civic Dollars program and many, many other groups. So it's a huge undertaking, but we're keen to get as many people as possible involved. And of course, the council can take a leadership role in all of this work. So.
Thanks very much, David and Adele. So at this stage of the meeting now, we'll open the floor for comments or questions. And the first indicated speaker is Councillor Devine.
Thank you, Chair, and thanks to Adele and to David for coming and presenting to us today. I attended the conference earlier on this year, a few months ago. I myself and Aisling discussed this, and we thought it'd be really appropriate that you'd come in and talk to committee here. So thanks for coming to do that. I retrained as a nutritional therapist last year. So this is an area that really interests me, and I've promised I wouldn't get on my soapbox and talk too long on it. I think the statistics are really stark. They speak for themselves. And I suppose one of the things is that I welcome is that obesity is no longer viewed as just being a health service issue. And it's, it's a cross-sector challenge that demands a coordinated approach. All of the parts of that system need to be engaged and working together. And I suppose I have a couple of questions as we go through. What do you see, or what have you experienced maybe as the barriers or the resistance from sectors in terms of the approach? I do think that our community planning model is an ideal foundation for the whole systems approach, because we have the key stakeholders around the table. The consequences, obviously, Adele, you've touched a bit on that, are profound in terms of health for the individual, their quality of life, their increased risk of developing a whole range of different serious chronic conditions, but also the financial pressure on our health system, which is already on its knees. Again, I think really interesting in terms of the statistics is that the prevalence is much higher in communities where there's higher levels of deprivation. And I think resource allocation must reflect on this going forward. I also welcome the move away from the blame culture for individuals. They don't have any willpower, and all they need to do is eat less and move more. And we know now that is simply it doesn't work like that. It's much more complex than that. In terms of environmental change, I think we really must tackle the influence of, Adele, again, you've just touched on it, the food industry. This is particularly in relation to ultra-processed foods. This is big business. They are making a real big profits out of this, and they're really important lobby groups. So I suppose I'd be interested in how we deal with that as well, because that's obviously much higher than local level. I'd been looking at statistics from the Food Standards Agency and from 2022, and they are presenting a picture where fast food outlets are clustered near schools, particularly in deprived areas, with some of those secondary schools having 5 or more foodlets within a 400-metre radius from them. I think as councillors, we have a really important role to play in terms of lobbying government for change challenging that aggressive marketing that's targeted children and vulnerable communities, pushing for product formulation, moving away from that harmful ingredients that are in ultra processed foods, and moving towards more nutritional quality foods, introducing policies that restrict the availability and the promotion of unhealthy options like our ultra processed foods or fast foods. And I suppose I'm wondering what more could we do as a council or as councillors to help with that? That's a question for you. I think council have a really important role in terms of physical activity through their having accessible leisure services or green infrastructure or parks or greenways, active travel. And I think as well in terms of support and planning policies that we need to be looking at that. I have asked that we look at the food that is provided through our leisure facilities. Karen, maybe you have a wee update on where we're at with that, just making sure that we're providing healthier options. I think our health service in our hospitals also a big responsibility, and I'd be really interested to see, what is your take around that, around hospitals and also schools and the foods that they're offering to individuals. I'm nearly there. I think prevention obviously is a big priority as well. And focusing the shift to creating environments that tackle the root cause before it leads to disease is really important. And education and practical support through education in our schools and through community support programs. And I know our community involved sector are doing really good work around that, particularly we're now faced with financial pressures for families. I do have some concerns about policy keeping up to speed with the research. I think policy often lags behind the most emerging research. And I'm just another question, how do you think we keep on top of that? How do we make sure that we're constantly at the cutting edge of the research that's coming out? And I suppose the other thing that is a big factor at the minute is around the whole weight loss medication. And yes, it's one thing, when it's regulated and it's been administered through a clinic, but we now know that it's readily available on the market to buy, and how we look at that. So that's it for me. Look, thanks very much for coming in today. It's really interesting, and I wish you all the best with the work in the future.
Thank you, Councillor Devine. And we can take the questions as they come, or if you want to wait to the end. Just want to go ahead and answer. Go ahead, yeah.
I think we probably need a couple of hours to answer all of those questions, Caroline, but you've certainly raised a whole range of things which we hope to address as part of the whole systems approach, working with other sectors. But one of the questions you asked about, what can the council do? And I have been in conversation with Karen McFarlane and Karen Phillips about access and training on health in all policies. And we have secured an expert from the UK to come over towards the end of February to deliver training on health and all policies, so that all of the councillors and senior staff and will understand the implications of their decisions around planning policy and procurement policies and the whole plethora of work that you're involved in. So that may help in some way. So that's one.
Yeah, happy if I come in on the back of some of your comments. Yeah. Thank you very much. I think they're all very relevant. There's loads going through my head just as you were speaking. I jotted as much of it down as I could. So I'll try and touch on as much as I possibly can. The barriers is kind of where you started in terms of how we take this work forward. I feel that some of the barriers to this work is that a couple of things. One, we often look at things in isolation. We don't look at things collectively. We don't look at them in collaboration. Even though you might be collaborating on an intervention, it's isolated. It's about a particular pocket and a particular sort of, cohort of people. But once that's done, it falls off the edge of a cliff because there's no more money for it. We need to look much broader in terms of how we do this work. So it's not that nobody's trying. People are trying, and they're actually helping those people with those interventions, and there's good success out of them because they've been evaluated and they're evaluating well. But when we look at the statistical profile, again, the new Northern Health Survey was just published. The rates of overweight and obesity from the report that was in your pack have increased again. And they've increased even more substantially within Derry City and Strabane. The rates now in Derry City and Strabane, I jotted them down last night just in preparation for today. So Northern Ireland average is 65%. It's 69 in Derry City and Strabane. Now it was 71, so we've made a slight improvement there. But whenever you look at then the breakdown, levels of overweight have went from let me see, 45% down to 32, but levels of obesity have increased from 26 to 37. So people in the bracket of overweight have moved in the wrong direction. So we might think we've done well in one sense, but we've done poorly in another. So as a result of maybe those isolated actions, we need to somehow change the way we're doing things. Even though we're making sort of progress with some people, it's not actually having the population health effect that we wanted to have. And the other kind of barrier for me is that everybody looks from the outside in and think that belongs to health. And you mentioned it within your comments and your questions. This needs to be about all departments, all of government, and we need to be put in the same direction because it's much more than health. Obesity is very, very complex. It's not just about get up and do some exercise and eat a bit healthier. We know enough now to know that's not the case. It's about genetics, it's about the environments that surround us, and they're not all healths. They belong to everybody, and we need to work together to be able to address those things. Couple of other things, and I think the support that I feel we need from yourselves would be one of the difficulties that I can foresee within this space is impact and outcomes. And you might think, where's he going with this one? But this is going to take a bit of time for us to see change. And we need to garner support from the most senior places to support this work, to resource this work, in order for us to be able to make the differences in the system that are going to have long-term impact. If we want change to happen in this space next year, I can guarantee you now we're not going to get it. But if you ask me, when is it going to come? It'll be 5, 10, 15 years down the line. But we need to start here. We need to start with the system changes. And we're not going to be able to do that unless we work on these types of approaches. If we continue to do what we've always done, we're going to get what we've always got. So we need support from you and senior people who have influence and can. So if it comes back then to if there's a legislative change being requested, if there's a policy change, can we garner support and link it all back to the whole systems approach to obesity work? Tier 3 service you also mentioned about in terms of medication. So what we're trying to do at the minute through partnership with SPPG, the Strategic Planning and Performance Group for Northern Ireland, is we're working with them to try and secure funding to put in place a Tier 3 service supported by medication in Northern Ireland, and then to build that forward based on the research and evidence that's there, because that will have an impact on reducing levels of obesity for people who need it based on the complexity of what we're addressing. But what we need then is we need to not just look at that Tier 3 service, we need to look at the Tier 2, the Tier 1, the Tier 4, and we need to have the continuum, because people in a Tier 3, once they go through that, if and when successful, based on evidence, which we hope they are, they need a Tier 2 service to go into. So we need, and then Tier 1, and then to generate back into, healthy weight, healthy behaviour, etc. So I think that we're working on a Tier 3. Hopefully we'll have that over the line. The Minister put an announcement out, I'm not too sure if you're aware, to have that service in place by January 2026. So we're working to that agenda in that time frame, and hopefully we do get there. And then a couple of final points. I can't remember what way you kind of described this, but it was about what can we do locally and what can we not do locally. For me, I'm really clear in my mind, and I've said this to all the people in all the leadership groups, including Derry City and Strabane, there's only so much we can do locally. So the local bit can be driven forward by the leadership group or by community planning. So there might be a particular partnership within Derry City and Strabane that can do something that we identify through the work of whole system. There might be something that needs a bit of collaborative gain that community planning can take forward. But there's a lot of this work that's going to fall into regional spaces, and that's not going to be unique to Derry City and Strabane. That's going to be, I suppose, relevant to all councils across Northern Ireland, all of our population. So what we need to do is we need to lift those up a level in the ROPIG. So that's the Regional Obesity Prevention Implementation Group. If they can't put an action in place, then it needs to go to OPSG and the department. And if it's legislative, we need to look for those legislative changes, and we need support for those legislative changes in terms of what we're trying to address, if that makes sense. And then finally, we just touch on, I think you mentioned the nutritional standards within council facilities, and the FSA are leading a piece of work around that. And I know, Karen, you're involved in some of that work. But in health, we have nutritional standards for the HSE, both, but that's for patients. And then we have vending guidance as well. And we've also got a food and schools policy and posts in place to support that work as well. So some of the things are already in place, but what we also need to think about is, okay, well, what are the changes we need to make, or the wee tweaks we need to make them even better?
Could I come in just with a couple of comments, quick comments as well? With regard to what the council can do. In some of the councils in England, they have adopted a declaration of 16 points, which is everything from strategic leadership, being aware of this whole systems approach to healthier weight and the reasons behind it, looking at the commercial determinants of health, looking at marketing of unhealthy food and junk food around schools, looking at planning, looking at availability of healthy food and drinks even within all of your premises and your facilities, looking at the environments and infrastructures to promote healthy eating and physical activity. You have done fantastic work in this council area around the greenways and the walkways and the parks and that. But there's also things within these 16 points, organisational change and culture shift, looking at your contracts that you have for the council, which I suppose are very significant, and try and maybe adding in something under the contracts around promotion of healthy foods and healthy drinks as well. And then just monitoring and evaluation. I thought that was a nice little framework for some of the councils to adopt. But just going back to a point Caroline made there about our conference, if you remember, we had invited the manager of the City Hotel, and he talked about the challenges for the hospitality sector, like around promotion of healthy eating and all the rest. He says when people are out for a weekend or out for a night's treat, they will eat whatever the fatty foods. But I've had conversations recently with a number of restaurants and bars in the town and challenged them around why is the menus for children really, chicken nuggets and all the rubbish that you can feed in our most precious resource, our children, the worst, absolute worst food that then you can find. And I found a great openness and receptiveness from a number of the people who own hotels and restaurants to doing something about that. And I think the council were involved in a piece of work a couple of years ago with the Food Standards Agency. They did an audit of restaurants across Northern Ireland and the menus for children. So maybe that's something as well that we could look at, some kind of practical things. I know David really pushes the very strategic, the six phase leads Beckett model, but I'm a pragmatist and I like to get things done on the ground as well. So thank you.
Thank you, Edale. And the next indicated speaker is Alderman McMorris.
Thank you, Chair, and thank you, Adele and David, for coming in today. Thank goodness Caroline went first, for there's not much left to ask. But I just want to make a few comments. I think what you're doing is the right pathway that we need to go. We've seen the benefits of collaborative working. Do you know what I mean? When we have all the senior leaderships all around the table, we see that with the UNICEF recognition recently. It was not an easy road, but it is testament that we got there in the end. Now I think this is something is probably even more massive than the UNICEF thing, but I do believe that the collaborative working and the working together and mapping this all out is very imperative. I'm probably not the best person to speak about overweight and stuff like that, but we have a lifestyle out there that we need to be changing, and I take it from my own point of view as well. Everything is geared. We're all living really busy, fast lives. And I know myself sometimes when I'm back-to-back meetings, the only substance that I might get in large periods of time is a cup of tea and a biscuit that's provided here. So I think that we need to have a systemic change within our own systems, even within council or whatever. As Deputy Mayor, I've been out on a load of events over the last 6 months. And I went into an event there about 2 weeks ago and they had fresh fruit. And I was just like, that there is amazing to see. I says, because I've been living off tray bags and cups of tea and sandwiches, and just to have fresh fruit was just, it was absolutely amazing. So I think that you're right. We need to be pragmatic as well. We need to be taking them small changes that we can make for everyday ones and make them into normal procedure, as opposed to, do you know what I mean, thinking, because we as community workers too as well, do you know what I mean? I was out last night at an event, and after the event we had tea, tray bakes, we gave all the wains a selection box, and do you know what I mean? And I was saying, look, there's nothing really healthy, and I know it's Christmas and it's a treat, do you know what I mean? But we need to get some kind of changes that are adopted in, do you know, especially like when we're talking about education pieces where their canteens are not healthy. And as you say, takeaway menus, and everywhere you go is burgers, chicken nuggets, sausages, and you're right, children are our best resource, and if we can't be feeding them healthy, nutritious food, then, we're never going to get anything right. Do you know what I mean? Because if we can't get that right, most as a parent myself, we know we would do anything for our children, do you know what I mean? So, but if we can't feed them nutritiously, then, we're all failing. But look, I do think it's a massive piece of work. It's something that's really, really, as you rightly said, it's probably 10, 15 years down the line before we see benefits. But, we have to start this now. And I just wanted to touch on that piece, and I know Caroline briefly mentioned it at the end. Somebody that is in the community, I am hearing so much about all of these injections and medication and whatever. And I think there needs to be like an education piece and around that, because I'm miffed as like, is this regulated? Is it healthy for me? Like, if I was to take an injection tomorrow, is it something that could lead to other issues for myself? You know what I mean? So I don't know what the right thing is to do and around that. And I know the doctors are giving it for diabetic, and it is making improvements there, although it might be small at this stage. But I'm hearing on the ground that people are losing weight, and they're getting more healthier and more active on the back of it. But I do think that there needs to be more messaging and around that whole piece about, the implications of these type of medications if they're not prescribed and put through a professional. We're seeing too much now of people just giving themselves injections, and they're overdosing on these injections. Some of them are taking double up just to see if the effects comes quicker or whatever. But look, thank you, Camilla. I'm not going to labour the point, because I know you have given a very comprehensive presentation, and everything you sent out, do you know what I mean, was like stark reading. But do you know what I mean? It certainly made us think about, the environment out there, whether it be through education, would it be through your council. And just the last point that just came into my head there, we have a piece to do in our council too, and around the planning. We're seeing thousands of social housing going up, and there's absolutely little or no community infrastructure and around that. Do you know what I mean? We're not seeing play parks being added into these communities, and different infrastructure that for physical activities and different things. So I think that we need to be looking at the whole thing about, adopting them into our processes as well, so that there is the infrastructure and everything out there that just makes it easier for everybody. But thank you so much.
Thanks, Nairi. And the next indicated speaker is Councillor McDade.
Thank you, Chair, and thanks, David and Elaine, for coming on. Or Adele, sorry. Jesus. I don't really have any questions, just a few comments more than anything. I love a whole systems approach. I think that's how it's how we'll fix the world, if we have the bravery to kind of tear everything down and look at the start and pull together again with it. We can't do that. But so I understand it will take a long time, but those small ones are really important. and I can't remember when it was, but I think it was on here as well. We talked about the kids' menus in restaurants, and it's always pizza and chips, chicken nuggets and chips, sausage and chips, maybe mash. You know, like there's never a healthy option at all. And my kids are young, so they do eat off the kids' menu. Like if we go out for dinner, very rarely do we go out because they're a nightmare. But do you know, like generally, if we're going out, they wouldn't order off an adult's menu. They wouldn't be able to eat it. They're only tiny. So they don't get a healthy option. And we've talked, loads of people have mentioned the word treat. And I think actually even changing that language is really important, because trying to kind of, role model like everything in moderation. Do you know, like it's not a treat. You don't have to reward yourself because you've done something good with a piece of chocolate. You can reward yourself with something else, and chocolate might just be a normal part of it as long as you're not overeating on the chocolate. I think it's about kind of developing that, I don't know, balance in life. And the slide that stood out for me was the one around all the factors that impact, and the highest percentage is the socioeconomic factors. So it's not surprising that Derry and Strabane have the highest number of, or level of obesity, when we have also got the highest level of poverty. And like if you're thinking about at home, like of course you've got as a parent, you try and make sure your children are eating healthy as much as possible, but actually role modeling, like going out to exercise and saying, right, mum is going to run now, and letting them see you going out to do it, letting you see you going to training. And for me, it probably did start off with about weight loss, but now it's more just about role modeling, and so they know that this is a normal way to be. Because and then now you talked there about the injections and medications, and I suppose communication is really key, because for loads of people, like I know, right? So I went to Slimming World for ages, and it was like really slow and steady, and Slimming World worked for me. But is that the healthy way to do it? Because if you talk to a personal trainer, they'll say Slimming World's not right. You have to do this, you have to macro count, and you have to do that. So it's just about, it's so confusing for someone who doesn't know what's the right thing to do. Do you know what I mean? So like, and Slimming World might not work for someone else, but it did for. Do you know what I think? It's just about is being really clear with the communication about how we actually improve people's diets. Um, the schools, the school that my kids go to is brilliant with healthy eating and healthy living. I have to say, my 6-year-old lectures me if I put chicken nuggets out, or if I put, like they lecture me about healthy foods, because full disclosure, my children get for chicken nuggets, of course they do. Do you know, like not every night of the week, but like I think it's important, it's really good to note that schools, especially I think loads of schools around Derry here is really good about educating them, and their menu goes up the week before and you can see what it is, and it's always balanced, and they do get a wee dessert, but it's not always ice cream. It might be fruit, one day and ice cream on a Friday or something like that. But again, the cost of living, I think that's a really big part of it, because if you're walking around Sainsbury's, it definitely is in the short term cheaper to buy the unhealthy stuff than what it is to buy the fresh fruit and veg and the fresh chicken from the butchers and all the rest of it. It's definitely cheaper to go for the handy stuff. So again, that whole systems approach needs looked at, especially in places with high levels of poverty. I'm trying to think, did I write anything else down? David, I admire your excitement to push this forward and your optimism. I really hope it remains. Because if we need all the departments in Stormont to work together and push in one direction, that's a big task. So, but it's an admirable goal. So here's hoping that they will pull together. But thank you very much for coming on.
Thank you, Councillor McDade. And the last indicated speaker is Alderman Hussey.
Thank you, Chair. I'm not a member of the committee. I appreciate the opportunity, and thank you for the presentation. And I will congratulate our council staff on what they're doing with regard to the lifestyle issues that they do, whether it's our greenways and all of that sort of stuff. I think somebody once made a comment to me, houses don't need kitchens anymore. You just go out and you buy the local chippy or whatever. And in fact, somebody said that there are houses in America now that they build with no kitchen. And one of the things that I think has failed the system is basically the withdrawal of home economics that used to be in our schools, where people were taught how to actually make. I remember those days when I was teaching. The home economics class was there, and boys and girls went. You're looking at me, Car. And that sort of thing where young people were taught how to actually cook and make food themselves. Caroline has touched upon it, and Councillor McDade has come in at the very end there on the issue of, mum and dad going with the basket, whether it's Lidl, Spar, Vivo, wherever, and they're going in there, and it's off the shelf, it's there and it's into the basket. That the stuff that we're talking about here locally, it's tinkering at the edges. And the solutions don't lie here in Northern Ireland. The solutions lie at Westminster. And they have to take on those bigger outfits as to what they are doing to our nation with the foods that they are making available on their shelves. Now, it's a big, big task. And they are big, big influencers. But that's where the real change can happen. That sort of shopping way of going about things used to be in the past. I mean, we grew up, well, I grew up, there was a butcher shop, there was a veg shop, there was all of those local shops, and you went and you bought your bits and pieces in the various shops, whereas now you go into one of those places and you just do, that's your week shopping, I'm away home. And they will look for the cheapest option. And that is not what always is good for people. And you talked about a system change there. I don't know how that's achieved, but it will not be achieved at Northern Ireland level. It needs to be a Westminster issue. And dare I say it, as a Brexiteer, a European level as well. There's that broad issue of food that is supplied to humanity by the large chains, and the influence that they have has to be curtailed within that whole system. Thank you, Chair. And, keep up the good work, but it's the boy putting the finger in the hole in the dike at the minute. Thank you.
Thank you, Alderman Hussey. And do you want to make any further comment? Go ahead, David.
Yeah, I just appreciate all the questions and the commentary. It's been really useful for me as well today. A couple of things, I'll maybe just touch on different things at points based on the comments that were raised. I think we need to remain optimistic. And I know you're saying you love my optimism, but we've done a lot. I'm going to flip into a different space in tobacco, where we have influenced it, Westminster, and we've made legislative change. I think we'll have to be ambitious, we'll have to be optimistic, and we'll have to try and drive change within this space. If we don't do it, I don't think it's going to happen. We have to keep drip feeding what needs to happen. And I think the more we do this in an approach where it brings local people and local areas together, and if you have this times 11 and it's all going in the same direction, then I think we're on a better path than sitting back and doing nothing and continuing to watch the issues rise around levels of overweight and obesity. I think one of the comments was about trying to get buy-in from all government departments. So one of the things that we're planning, based on the learning that we've had to date, we're doing training for each of the early adopter sites. In and around the same time that we're doing the training for Derry City and Strabane in terms of the leadership group and the workstream group, we're going to put in place training and get senior officials within each of the government departments onto that training to train them in the whole systems approach to obesity, and to get involved in the mapping of the local systems for whole systems across Northern Ireland. And I think that's a really important key step, so that they can really get underneath the skin of this and understand what do we mean by whole systems change and why does our department need to be part of this. Two more points before I just conclude. Messaging is really, really important here, but it's so difficult because you're up against the big players. But not only the big players, you're up against people who are trying to make a living, who are on social media, who are giving out wrong messages. So how do you actually put a lid on that, and how do you pull it all back? And that's really difficult. But through this whole system, we need to try and find a way to curtail misinformation going out in the public domain. And I totally agree with all the comments you've made about the cost of food and how it's displayed on shelves. Like, I'm a human, I'll go into a shop and I'll see a treat, and then I see the one that's on the shelf down the aisle, and I see the one that's on the end display. It's high in fat, salt, and sugar, but it's double the size and it's half the price. What one are you going to buy? And then when you buy it and you get it home, do you eat half of it because it's the same size as the one you were going to buy? You don't eat it all. So the whole system's broken, and we need to do things and take steps to make change. And the ultimate thing for me is, how do we change a 4-pack of a chocolate something and a packet of strawberries, when you look at one against the other, one's £1 and one's £3, and you can all work out which one's dearer. You know, fundamental changes are needed here in terms of how we support our population. But that whole bit around communication from, I suppose, a professional lens without dictating to people is really, really key here. So how do you build that back in terms of nice guidance and injectables and what that means and what you can and can't do and what's safe and what's not? All that stuff needs work through. And for me, the whole system needs to look at all those different things and come up with a plan and a set of actions. How are we going to deliver this? Who's going to do it? When's it going to be done? Etc. etc. Not forgetting all the local quick wins that we need to do along the way. So this has to be a dual approach as we move forward. It's not just about the big ticket system changes. It's about all those smaller things that need to happen as well. And then where I'll finish is just to say, not too sure if you're aware, but the new obesity prevention strategy was launched last month, called Healthy Futures. And that Healthy Futures strategy for the first time is actually looking not just at prevention, it's looking across the 4 tiers of right from educating the public into tier 2 services, tier 3 with your injectables, and up to bariatric surgery. So they're looking at the whole patch, and that's really key and important moving forward. And we worked really hard with the department to try and make sure that a whole systems approach was embedded within the new strategy, and it's front and central. So we've actually now got the strategic prioritization and support for this work as we move forward, and hopefully the optimism can be carried through in terms of some actions that are going to make a real change.
Thank you very much, David. And we have one more indicated speaker. Alderman Montgomery has just indicated to speak online. Do you want to go ahead there, Janice?
Thank you very much. A lot of it's been covered, but I just want to thank David and Adele for coming in. A lot has been covered that I had wanted to mention. It was around the food shops and stuff like that and the price of everything. There was one issue that was just to kind of put it out there that I work with children, and more you see children with sensory issues, particularly around food. Where you think a chicken nuggets and red sauce is just chicken nuggets and red sauce to them, you could try 10 different options and none of them would suit them. And I'm just wondering, when you're talking about maybe making changes to menus and stuff in restaurants, would there be consideration, or have you thought about helping those with sensory issues?
We are involved with Derryn Strabane District Council and the Community Foundation for Northern Ireland with the Acorn Farm, and there's 2 strands to that major flagship project. There's one, I Can Grow, and it's reaching out to 1,000 families in Derryn Strabane to get them to get food, grow boxes and start growing their own food. But there's also an education element to it, which is there's I Can Grow and I Can Cook. And I know that one of the strands that we have been looking at is what we call fussy eating. Now that could be for all children, but certainly it's something that we should be looking at and we will look at in the future.
That's great. Thank you very much.
If I could maybe just come in as well, I think one of the things that we need to be doing, Councillor Montgomery, is whenever we think about these actions that come through the whole system, or any action for that matter, we need to do impact assessments on the impact that it has on the different groups within our population. So having highlighted that issue, hopefully we can, identify all of those issues which are important, and then try and, make the intervention suit all those issues as we move forward. So if that's an example, then, and we're doing an impact assessment in whatever way, shape or format it needs to be, we can consider those things so that whatever we put in place is actually suitable for the whole population, not just the majority, if that makes sense.
And just to mention as well, children and adults with learning disability are at particular risk of becoming obese because people often give them food as a reward for good behaviour, and that's an area that has been flagged up to us and something that we hope to be working with as well with schools and with parents and that. So it's one of the priority areas.
Thanks very much. No other indicated speakers? So what's left to do is just thank you both for coming in today and for the very, very comprehensive report, which is a great tool for us to have both in our own jobs that we do out in the community and also as councillors. But I also attended the conference myself and Councillor Devine, and it was packed full of lots of very useful information. But for me, it just reminded us of how much work we actually have to do. But I just have to commend you for taking that first step and starting it, because it has to start somewhere, and bringing along with you all those other stakeholders in order to make this happen is commendable. But it's just a couple of wee points that I have picked on today, and that's a prevention piece. And I suppose for me, as you rightly said, Edel, the young people are our future, and it's about educating them around the foods that they are eating, the environments that they're living in, but it's also educating them about having respect for their body, understanding the functioning of the organs within the body and what they actually need to grow up and to be a healthy adult and live a full life. And I suppose the community and voluntary sector can be commended for doing that. There's a lot of work going on within the schools in relation to showing children different types of foods that they may not eat at home, but they get a chance to try in school, take the messaging back and encourage parents to purchase those foods and cook them at home. But one thing for me is, and I, with my 3 children and even my grandchildren now, it's great when they're at home, when you're cooking a dinner and you're sitting them down. Once they hit the teenage years, I found it very difficult to control what they were eating when they went outside of the home. So I think embedding that messaging about the health of their body is really, really important. And that comes down as well to health literacy, which I think there's a lot of work going on at the minute through the community and voluntary sector around health literacy, because we see a lot of intergenerational attitudes with parents, which are passed down then to their young children. So understanding health, understanding the literacy around health and well-being as a whole is really, really important too. And the policies that Councillor Devine spoke about, workplace policies, school policies, home policy, home rules, home boundaries, it all begins at home. And that messaging is so, so, so important. And we saw initiatives like the Live Better. We're seeing the Test and Learn transpiring now in relation to community development. That could be something that needs to be looked at in relation to the whole systems approach as well. And also the messaging. The messaging is so important in relation to, I know the messaging around healthy and unhealthy, but it's really important about keeping our young people safe. Talking about weight sometimes isn't, it can have a negative effect on young people. So I think the messaging around it when we are talking to them needs to be really thought through and focus on the inward health rather than how you look on the outside. So the I Can Grow, Edel, I was one of those 200 people that signed up for it. And just a wee funny story, every time I'm cooking carrots now, I have to pretend to pull them out of the grow box because the grandchildren helped me bring the carrots out when they were ready. And now they say, we're not eating them, Granny, unless they were out of your grow box. So I'm out sticking carrots. I'm going, yes, get me carrots. So just a bit of fun. We small secrets out. Hope they don't watch this in years to come. But just wee small things like that, they have a long-term impact as well. So thank you so much for coming on. We can't wait to hear more about it as this initiative progresses, and you've the full support of this council in relation to any messaging and any work that we need to do from our end. So thanks a million and safe home. Happy Christmas.
Sorry, Councillor Devine, just to say our vending contract is due to be advertised and retendered, and included in that is the FSA guidance in terms of calorific content. And we know there's more work to do in terms of our corporate offer, our franchise catering offer on our sites, and we're happy to bring a paper on FSA guidance through to a later committee in the start of the new year. Thank you.
Thanks very much, Karen. So members will move on into the body of the meeting now, and the next item on the agenda is chairperson's business. So I have 2 small items that I would like to chat about today. So the first item is in relation to, I suppose we've all heard in the media recently around the issues that Nazareth House Primary School have been having. The children are no longer in school due to a defective roof, and there has been a lot of gathering of organisations to pull together to provide some resources for the school in order for the children to have a good Christmas. And we're just chatting about healthy children, physical activity, healthy eating. So as a Health and Communities Committee, we had just been discussing about council reaching out to the school and speaking to them about providing the children with a swimming pass that they can use over the Christmas break. Obviously, they're missing out on their PE lessons. The principal, Roisin Blackray, has been trying her best to keep school life within their daily routine, even though they're at home. But I think as well, it's a nice gesture for the parents to receive something that they can go and enjoy with the children over the Christmas break. So if everybody's in agreement, Karen will initiate the conversations with Roisin Blackray and we'll see where it goes from there. But I do feel as a council, we should be contributing to any type of intervention that's going to make it a wee bit easier for the school community as a whole. Is that okay with everybody? Thank you very much. And the second item on my agenda, and it's something Nairi is going to come in as well on this, we both had sort of the same idea, is around the winter preparedness. As everybody knows throughout the media as well, we have been told about the rise in the flu and that is just going to get worse, particularly over the Christmas break. So I just wanted to ask council that if they could support all winter planning efforts, either through the PHA, whether it's through GPs or the trust, and integrate that winter health messaging under the comms plan over the next month or two, so that we are reinforcing those positive messages around hygiene and how to treat a cold or a flu. And Nairi's going to come in off the back of that as well, because she had emailed me to talk about this, but from an immunisation point of view. So go ahead, Nairi.
Thank you, Aisling, and thank you for letting me in. Yes, I was at an end on violence against women and girls event, and I was speaking to some of the health workers that was there, and they were basically saying that the rates for immunisation in our city at the minute is way down in comparison to other places in Northern Ireland and even in the UK. They were basically saying that, you know, for the first time ever, we no longer have herd immunity, you know, which is really concerning. But they were, and I know we were talking about the winter and the flu strains that's out there, you know what I mean? But we have conditions like meningitis, which are very preventable, which are life-threatening, do you know what I mean? And we have a case where people are not bringing their children forward to get immunisation for like the likes of meningitis and all the different other vaccinations that they can get. So I was just thinking, you know, and around the media, you know, our social media and whatever kind of message that we can get out there. Do you know what I mean? I just learned the other day it's probably somebody who's known to a lot of people through council, Martin McCartney, is actually in ICU with strain A of the flu and really ill. And I was talking to a relative of Martin's, and they were really concerned about him. Do you know what I mean? So I'm hoping that he's on the path to recovery. But you know, this is something that is really prevalent in our communities at the moment, where there's different strains, like we've had COVID and we've had, you know, all these different strains is about now that was never heard of years ago. But it is so important that we immunise our children, immunise ourselves, and making sure that anything that can be avoided is avoided. And we have a lot of vulnerable people in our communities, you know, and if we need to be making sure that carers and stuff are basically getting immunised, because they could be taking things on the, you know, older and vulnerable people in our communities. But thank you, Aisling, for allowing me in, and I know we're on the same wavelength of it, but thank you.
Thank you, Alderman McMorris, and obviously we'll send get well wishes to Martin. He's a great community activist and I hope he gets well soon. If you can pass on those get well wishes to his family. Thank you, Nairi. That's the end of Chairperson's business, and we will move on to item 7, and that's the matters arising from the open minutes of the Health and Community Committee held on the 13th of November. And Councillor Raymond Barr.
Thank you, Chair. It's item HC 288/25, like that there is. I know Seamus gave me a wee update on this last week, and thank you for that. But I just want to touch on a meeting that myself and Alderman Hussey had with Artie residents on Tuesday past, and the council officers here. Well, the concerns of the residents have been well documented over the past 5 years. And after Tuesday's meeting and what we've seen and heard, I find it astounding that the situation still continues. In fact, it would appear to have got worse. The lack of urgency on the part of some statutory agencies and Lakeland to address the issue is, in my opinion, totally unacceptable. There's serious questions to be asked over disposal, pollution, volume of tankers leaving the site, tankers coming and going outside of permitted hours, but most importantly, the residents still have to live with this foul odour, which is having a serious detrimental effect on their physical and mental well-being. From the outside looking in, one could be forgiven for thinking there was a more sinister backdrop to this issue. But however, residents still want a multi-agency meeting with relevant agencies and councillors. They claim this was promised for September, but never took place. And I would just like to propose that that council facilitate same meeting. Thank you.
You seconder for that, Glenn? Seconded by Catherine. Alderman Hussey.
Thank you for allowing me to come in. As I said before, I'm not a member of committee. But just to endorse Councillor Barr and the proposal that's coming through there. As he's highlighted, this isn't something that happened yesterday or last year. This has been going on since 2014 and it's still not resolved. Now, that is simply not acceptable. Minister Muir gave an assurance that the situation would be resolved last July. It has not happened. So where is the minister in all of this ongoing situation? I know that Seamus has told me about an order issued against the firm. They are now taking a legal challenge against that. So, where is the real blockage? I think my last comment tells us where the real blockage is. This firm have no notion of working with agencies. They simply want to delay and delay and delay. And in the meantime, it's the people of Ardegarvan who are suffering. And has been indicated there, this stuff leaving the plant, where the hell is it going? Where is it going? People need to know that sort of information because there is a wider environmental impact that hasn't been truly highlighted at the moment. It was indicated to us by the group where they think a lot of this stuff is going, but that needs to be investigated and followed up by the appropriate authorities. Thank you, Chair.
Thank you, Alderman Hussey. We'll move on to agenda item 9. Oh, sorry, Catherine, did you want them on this? Right, go ahead.
Not on the Lakeland stuff, just on matters arising, if that's all right.
Go ahead, yeah.
Thank you. So HC 28025, it's just from the deputation that we had from the trust. It was announced today that Neil Gockian is retiring as the Chief Executive of the Western Trust. So on behalf of the SDLP, I just wanted to wish him luck and thank him because I don't think many people would want that job. He's led the trust through really difficult times, and I suppose he's been quite outspoken on a number of things that I can definitely admire him for. When it came to the anti-racism, when there was racist attacks last year, he did stand up with his staff and took a very strong stance. So I just wanted to thank him for his work within the trust and wish him luck and look forward to seeing who will be replacing him. But thank you.
Thank you. Catherine, Alderman McMorris.
Thank you, Chair. And I'd just like to echo the sentiments to Neil on his retirement. I've been working with Neil for a long time, sending different constituency issues. I've always found him a pure gentleman. He has accommodated meetings with patients and people that, he had no need to do, but he gives a personal service. And he also gives personal assurances that he oversees things, and he does exactly that. I'm gutted to hear that he's retiring. He was a really, really good chief executive with good knowledge and done what he said on the tin. But from the DUP perspective, we wish him all the best, and he'll be sorely missed.
Thank you, Alderman McMorris and Councillor Duffy online.
Thank you, Chair, for allowing me in, and thank you, Catherine, for raising it. I did see it announced today that Neil was retiring. I think probably we had expected it coming, but just as well to put on record Sinn Féin's thanks to Neil for many great years of service, and particularly through some really, really difficult times, and particularly over COVID and the pandemic and everything that we had to endure then. He showed great leadership for the trust. And I suppose as well, last year we were over in the hospital with him when he was standing in terms of the anti-racism stuff against the staff there. So he has led a great staff team. He has shown great leadership through some difficult times, and particularly around the financing as well of the health service. So put on record our thanks as well to Neil at this time, and wish him all the very best with his retirement. And we hope to see him again before he actually does go, because I don't believe he's going until April. So, but well done, Neil, and thanks for your service.
Thank you, Councillor Duffy. Any other matters arising? So we'll move on to the matters arising from the open minutes of the Special Health and Communities Committee on the 19th of November. Any matters arising? No. Item number 9, the implementation of the age-friendly employers pledge, and that is Barry.
Thank you, Chair. Members, this is to seek your endorsement for council to agree to sign up to the age-friendly employer pledge. As part of our age-friendly contract, members, between PHA and the council, the PHA is now seeking council to sign up to the age-friendly employers pledge. It's a nationwide initiative by the Centre of Ageing Better, who recognise the importance and the value of older workers. Currently, over 450 employers have signed a pledge, which includes other councils such as Fermanagh, Omagh, Ards and North Down, Manchester City Council and more. Council already meet most of the desired outcomes, and signing the pledge provides a public statement and recognition highlighting Council's continued commitment to age-friendly. And signing up to the pledge would also set an example to other businesses in the city and district. Members, once the pledge is signed, the HR team will have access to a wide range of best practices, resources, newsletters and webinars that promote initiatives by age-friendly employers. So in terms of recommendation, members, that you recommend that council sign up to the age-friendly employers pledge. Thank you, Chair.
Thank you, Barry. Councillor Clark.
Yep, thank you, Barry. This is actually a brilliant initiative. I myself now would be classed as an older worker because I turned 51 last week. And according to this, once you hit 50, you're classed as an older worker. So I'm not ready to lie down yet, but I think we should always recognise the value of older workers. We should recognise their knowledge, their expertise and their skill sets that they bring to any setting. And it's very encouraging the 450 employers have signed it already. I think it's important to acknowledge we are actually an ageing population, so it's always important to strategise for the workforce, as in years to come we're going to be relying more and more on older workers. So this is very important, and I would propose that, definitely.
Thank you, Councillor Clark. Councillor McDade.
Thank you, Chair, and thanks, Barry, for the report, and happy birthday for last week, Amanda. I agree. I'm happy to second the report. We need to be investing and looking after and strategizing for our older workers, because reality is that we're all going to be working longer, so we're all going to be older workers. I don't think over 50 sounds a bit stupid to say that that's older, but do you know, like we're all going to be working into your 60s, probably even later sometimes, depending on what pensions are and all the rest of it are. So I think we need to be kind of working towards it now and making sure that we're supporting people. So I'm not happy to second it. Thank you.
Thank you, Catherine. Alderman McMorris. I can't speak today.
Thank you. And yeah, I also, Amanda, was devastated when I seen 50. I thought, jeepers, am I in the old people's bracket now? And I'm older than you, so that even makes it worse. Do you know what I mean? The fact that, you know, we're just hitting, oh, whatever. But anyway, do you know what I mean? Yeah, this is something that we should really be doing. You know, we have valued workers who bring a lot of experience to a lot of workplaces. And, you know, we should be supporting them and making conditions in the workplace suitable for them. You know, equally, I feel as if, like, you know, if somebody isn't fit to work into their, you know, their old age, then, you know, it is a right to be able to come out of work as well. Do you know what I mean? So I think it's more rights-based that we need. But certainly, if people want to retain working and going by pension rates at the minute, you know, I was calling bingo the other night for some mad reason, and I was saying pension age 65, and I was going, that's not for anybody in this room. But anyway, it'll be probably 70 before we can retire, some of us in this room. But yeah, we are very supportive, and thank you for bringing it forward.
Thank you, Alderman McMorris. Any other speakers? No. So the next item is item 10, Oakland Park Pitch Improvement Works Update, and that's Barry again.
Members, this is to update you and subject to successful application, seek approval to purchase land at Oakland Park from the Northern Ireland Housing Executive. Members, he's previously approved pitches pavilions reinvestment work with further update provided that secured budget for ground improvement works at Oakland Park Pitch. These works include pitch fence, footpath, turnstile and ball stop. Due to the land ownership issues with the area where the ball stop was planned, it was agreed that stage 1 would progress. Officers have now provided an update that stage 1 was complete and officers were progressing land issues for the ball stop as part of stage 2. It's been confirmed the land is owned by the Housing Executive and land sale application was submitted in July 2023. Council received correspondence last month requesting confirmation if we wish to proceed with the sale. Housing Executive has had the land independently valued and the value is £2,000 and the purchase cost would come from our existing approved budget for the work. So the recommendation, members, note the contents report and subject to successful application approved purchasing the land as outlined in Appendix A. Thank you.
Thank you, Barry. No indicated speakers in that one. We'll move on to item 11, and that's the Good Relations, additional funding for racial and social unrest 25-26 and the Northwest Anti-Racism Charter, and that's Barry again.
Thanks, Chair. Members, this to update you on the additional fund of 30,000 received from the Executive Office and to seek your approval on the formal adoption of the Northwest Anti-Racism Charter. You'll recall, members, in July this year, the TO initially reached out to provide additional funding to the Council in response to the racial and social unrest. TO subsequently reached out inviting applications to bid for further funding to build upon this initial programme delivery. Council have facilitated a number of public consultation sessions in person and online in relation to seeking the views and ideas from key stakeholders and interested persons and groups to develop the programme of delivery to address priority needs identified. A bid for 27,000 was submitted to TEO and following approval of the bid, a funding award letter enhanced by a further £3,000 to a total of 30,000. And you'll see that in your Appendix A. Members, the funding allocation in the proposed programme will provide additionality to the local community group partnership boards plans across the council area, building on both the good relation activities planned and delivered to date. In addition, it will build on the initial phase of funding to address racial and social unrest and improve social cohesion, which initially targeted the 3 days of Ballyarnett, Moor and Waterside. With regards to the Charter, members, by formally adopting the Northwest Anti-Racism Charter, Council is endorsing a strong message that the City and District will stand firmly against racism, Islamophobia, xenophobia and hate in all its forms. This adoption represents a collective pledge to say no to racism in every form and to promote a culture of respect, inclusion and equality. Members, in terms of the finance, was already highlighted. A letter of variance was received in October for £30,000 and it's 100% funded by TEO. So with regards to the recommendation that members approve the additional funding allocation of 30,000 and the delivery of the programme to further address any racial and social unrest by the 31st of March 26 and that members approve the formal adoption of the Northwest Anti-Racism Charter. Thank you, Chair.
Thank you, Barry. And first indicated speaker is Councillor Clark.
Thank you, Aisling. As you know, you and I both signed the Anti-Racism Charter back in May, and I think Lillian was there that day as well at the launch of it. I think as a council, we have to stand firmly against all forms of racism, and it's all shapes of it. Now, this resonates with me really, a lot at the minute. I'm dealing with a constituent who has been racially abused in her home. Her home has been attacked and her and her child are living in fear. And it's not until you're dealing with something like that you realise the fear that's attached to that and it radiates out amongst, you know, the rest of the residents and stuff. Now we managed to identify the culprits and the scary thing about it was they were all 10-year-olds. So I think that the likes of this money here, and these charters should be taken under the likes of youth clubs and schools, because you're not born racist. It's a learned behavior and it's learned languages. So I think, we need to be more proactive. Rather, we're being reactive now because that's just the way it is. But I think to nip it in the bud, this charter needs to be maybe promoted within, youth centres and schools. Because it's scary that it's wee children at 10. And when they were challenged, they didn't even understand what they were talking about and what they were saying, but it's inherently racist, and that's what they're learning at home. So I think it's very important to get it young. So thank you.
Thank you, Councillor Clark. Councillor Sinai Barr.
Thank you, Chair. And let me start. Thank you, Barry, for the report. I welcome it wholeheartedly, but I want to first declare an interest because I'm the CEO of the Northwest Migrants Forum, and we were very much involved in developing the anti-racism charter with the Irish Network Against Racism and the Bloody Sunday Trust. So, and other stakeholders who came on board. So I want to express my full support for the recommendations in the report and to commend the council workers also for engaging in that process of tackling racism in all its form within our city and district. The anti-racism charter, as it has already been explained, it's a very important step, not just symbolic, but it is practical because it sets out clear expectations about how we treat one another, how we protect the rights of minority communities, and how we build a city where everyone belongs. I was one of the and I'm still one of the champions of a community that has shown what belonging means because I became the mayor of this city and district. So it may look really bad out there on social media, and it is. We are at a time where minority ethnic communities are experiencing growing hostility, and there's a lot of fear out there, but we are still a better city than many other places, and we should celebrate that in our council. The fact that council is signing up on an anti-racism charter, the first of its kind in the whole of the North and even in Ireland, is a step forward, and we are leading by example, showing what we should do as a council and as a community in welcoming communities and looking after them. And the additional good relations funding outlined in the report will also make a real difference. It allows us to strengthen our community cohesion, provide a safe space for dialogue, which is absolutely required. This is not just for young people in schools. It starts within their communities. It actually starts with the adults at home. The young people are picking up what their parents are saying, what their uncles are saying, what their grandparents are saying. This is why this grant is so important, because it supports our communities and community groups out there to engage with the whole population without prejudice, to discuss these issues in safe environments. So I really welcome that part of the report, and I strongly welcome this and encourage our council to continue investing in this work because it is needed now more than ever. So thank you very much, and I'll take the opportunity to propose that we endorse the report and approve it.
Thank you, Lillian. Councillor McDade.
Thank you very much, Chair and Barry, and Lillian has covered obviously everything, but I just wanted to add that there's the anti-racism charter it's a brilliant kind of thing to be signing up to, and I know that local schools and sports clubs have all started to sign up to it too, and I was just trying to really quickly look to see, and definitely Life Cycles over in the train station, Ardmore Cricket Club, Lisnagelvin Primary School and St John's Primary School have all already signed up, so I think it's good to get that out there for the likes of schools and sports clubs and all them kind of younger generations then can kind of learn about it and can be embedded into their kind of everyday life, whether it's through school or whether it's in their kind of extracurriculars. So naming the ones that have done it might pull more out as well, I think. So just to kind of recommend and encourage schools, youth clubs and sports clubs to get involved with it as well. Thank you.
Yeah, I agree, Catherine, and I think we're seeing more of the photographs popping up online of Maeve and the team at Bloody Sunday Trust presenting people with the lovely framed charter. We have one in the office at work, but again, it's going back to what Councillor Clark was saying around it begins at home. And whilst we were developing the charter, we did say it's about families adopting the charter, hanging it in the hallway and letting children know what they stand for, and that racism can't be tolerated in any shape or form. So thanks very much, Barry, for the report as well. Any other speakers on that item? No. So we'll move on to item 12, and that's the progress report on service delivery plan for the licensing and public event safety section, and that is Seamus.
Thanks, Chair. Members, the purpose of the report is to update you on the licensing service delivery plan and seek approval for additional resource in order to assist Council meet its statutory obligations. Members, the Department has a delivery plan which outlines key activities including service improvements, and these are outlined in Appendix 1. In order to implement the necessary service area improvements and support local businesses and residents, an additional member of staff is required. And members should note that some of the improvements are designed to maximise income generation from licensing fees and charges, which would help offset the cost to employ an additional member of staff. So members, you're asked to note the service delivery progress report and approve the recruitment of one officer to assist delivery of this statutory service. Thank you, Chair.
Can we get a proposer and a seconder for that? Proposed by Councillor Devine, seconded by Councillor Clark. Thank you very much. And Alderman Hussey?
Yeah, thank you for the opportunity, Chair. Just a couple of questions on it. With regard to SAG, I note one of the constituents within that is City Centre Initiative, which is all very well when events are happening in the city. With regard to the likes of Strabane, for example, would the likes of Strabane Bid be invited in to a SAG meeting if there's events being held in Strabane? I think of other communities where SAG do have an input into the delivery of the events. So in what way are communities beyond the city considered within the SAG considerations when it's events that are outside the city? My second point, some time ago, I understood that the licensing team were looking at the issue of the smaller events around the country where street trading would be part of those smaller events, and the issue of trying to evolve a collective trading license for that small group of traders who would involve themselves in, for example, the likes of the Apple Fair in Castleberg, to use that example. Thank you, Chair.
Through you, Chair, in relation to the first point, Alderman Hussey, the SAG service is a non-statutory service, and the event organisers would complete a form outlining the background to the event, capacity, and basically what support they require as well. So all the statutory partners would be invited to review the event safety plan, and any other partner that wants to get involved or have input in terms of the decision-making process, well, not so much the decision-making process, but just to provide advice, are welcome to do so. So there's no restriction in terms of who can input to any events. In relation to your second point, there will be a report coming through to January committee in relation to street trading, including designated streets, and that'll cover the various options that members can consider.
Through you, Chair. Thanks, Seamus. Thank you.
Thank you, Seamus, for that update. We will move on to agenda item 13, and that's the DERA data sharing agreement with our council on animal welfare, and that's Seamus again.
Chair, I don't intend going through the report, so it's just to seek members' approval of the data sharing agreement between DERA and Council to facilitate their respective statutory regulatory role in relation to animal welfare.
Proposed by Councillor McDade and seconded by Councillor Senoy Barr.
Chair.
Yeah, sorry, Alderman Kerrigan online.
Chair, thank you very much for allowing me on. I'm not a member of committee, but I suppose I've just taken an opportunity when we have that particular item that Seamus has just that they've just had proposed and seconded there in regards to DERA, and I'm not just going to just if maybe we could get a paper brought back at some stage in regards to this, because Seamus will know the case that I'm referring to without going into detail. In regards to the powers are not fit for purpose in regards to cases with dogs. And I mean, he knows the case that I'm referring to that has been ongoing now for in excess of a year, and there's still livestock being attacked by by dogs which appear to be owned by a responsible dog owner, and these dogs are still not lifted. I know we're looking at a potential court case, but it's just taking too long, and that's not the council's fault. And I just feel that there needs to be something done via DAERA. So I don't know if anything can be brought back at some stage, as into maybe something that we could put to the DAERA, to the department, in regards to suggestions as to how this could be improved, because this has been taken to PSNI, and the PSNI won't do anything with it unless there is, you know, a person is effectively attacked. And again, I'm dealing with a lot of very, very frustrated farmers, and Seamus is aware of that, as are the dog wardens. And you know, there are calls coming every day in regards to this. And again, when it is in relation to the this data sharing and this information, I just think it gives us an opportunity, maybe, Chair. So as I say, I'm not a member of committee, but if maybe Seamus could maybe take a wee look at this and maybe come back to a future Health and Communities meeting, it may well be of benefit. Thank you very much for allowing me in.
Chair, through yourself, I'll not comment on individual case that Alderman Kerrigan's referring to, other than enforcement action is ongoing. But I'm happy enough to bring a report back in January just in relation to the Animal Welfare Service. And should that particular case go through the courts, then I'll be able to provide an update on the outcome.
That's great. Thank you, Seamus. Agenda item 14, members, and that's the Department for Business and Trade grant offering on capacity and capability building programme in the North of Ireland 25-26, and that's Seamus again.
Chair, the purpose of the report is to seek approval to accept an offer of grant funding of up to 49,500 by the Office for Product Safety and Standards for this financial year. The OPSS is...
They're happy to propose.
There you go. Seconder. Councillor McDade. Thank you. Great. So we are now open for information, and I'll call them out one at a time, and hopefully I see who puts their hands up. So item 15 is the IPB Pride of Place Awards 2025. Item 16, Cooperation Ireland Voice Matters report. Item 17, Local Authority Sports Capital Programme. Yeah, go ahead, Councillor Devine.
Just a question in relation to that. Is a programme, or is there any thought going into what might, were we presenting something for the rates estimate for next year in terms of a sports capital programme?
There are a series of rates pressures being prepared for each directorate, and that will feed into the discussions that are planned for members in, I think, January at this stage. And yes, there is a consideration in terms of proposal. However, to say to you that in developing a scheme and taking it through that sort of design process and screening, etc., whatever, it may be that the development of a scheme would need to be implemented across a multi-year timeline as opposed to within a single year.
Thank you, Karen. Item 18, DAERA noise complaint statistics 24-25. Item 19, HMO licensing and enforcement, ministerial statement and correspondence, and that's Councillor Sinoy Barr.
Thank you, Chair. I want to raise a couple of points just following on the Minister's letters and the issues that has been raised by CRUM with our team, because the concerns go right to the heart of protecting our residents and our neighbours, and also the integrity of the policies we have endorsed in this council. So the correspondence from the Minister makes it very clear that there is a growing public concerns around HMOs and that are being developed, and how the loopholes are being exploited by others. And as a council, we need to be absolutely clear that our corporate policy of keeping on HMO's concentration to 10% is firm and must be enforced consistently, because we cannot allow ambiguity or loopholes that put pressure on our long-term communities, especially those around the areas that HMOs are just popping up. Just to go through what CRAMS has raised with us, because it is extremely important. At our last planning meeting, my colleague had raised a concern and it comes to about the occupancy itself, but we also have issues on licensing. And licensing considers occupancy through minimum room standards, but the number of occupants affects residential character, amenity, noise levels, parking, waste, and safety. And my colleague had raised the same concerns in the last committee meeting. An example that was given was a 4-bed HMO with 4 residents is fundamentally different from the same property housing 8, 10 or more people. And this council through the planning department absolutely does have the role in controlling occupancy through conditions. Passing this solely to licensing cannot be accepted. And because it does not align with our LDP policies anyway. So CRAMS have also highlighted that planning has chosen not to introduce a single occupancy room per room limit. And if we do not address this gap, there is a potential risk of developers or those applying for HMOs to capitalize on it. And the people who pay this price are the residents living in those areas who will be overcrowded and it will be poorly managed HMO. So we really need to close this loophole by being extremely clear on our policies. I know that CRAMS were here and they provided a comprehensive PowerPoint, really given some evidence that the numbers used to justify the 30% cap were inaccurate and including properties that were no longer HMOs under the HMOs Act 2016. And at that time, this was not accepted, but the PAC has since challenged that view. And I think we should not ignore the concerns that have been validated independently. There are other concerns, such as who regulate occupancy when a HMO does not require a license. And a crucial question that was raised is if a property requires planning approval as an HMO but does not require an HMO license under the 2016 Act, who prevents that property from housing up to 20 people. Now, it appears that nobody holds that responsibility clearly, and that is where the problem is. So we must ensure that our planning conditions explicitly prevent overcrowding and protect the character of the residential street. And what we need is a consistent message coming from our council. Our 10% corporate policy needs to be upheld. The minister has made it very clear that this council has the powers, so we need to get on with that. HMOs must not be allowed to cluster unchecked or intensify through backdoor occupancy increases. We have the obligation as this council, because we have an enforcement team and we really need to step up on that. Planning and licensing and enforcement needs to work together, not to pass responsibility between each other. And because we all really deserve that clarity and the consistency, and our residents deserve protection from inappropriate intensification of HMOs. For those councillors around, particularly Foylside area, every single day we receive emails from our residents. So we need that clarity as much as our residents needs that clarity. And I want to conclude by just thanking CRAMS for really working very hard on this particular issue. I think we all share the concerns that they are raising and we all need that clarity. So I am asking that we reaffirm our corporate position of a 10% HMO limit without any loopholes. When that paper, I know that we requested council to prepare a paper through the planning committee last week. We need those reports to come as quickly as possible, but also with clarity and doesn't leave any loopholes. And we seek those clarity from officers on how occupancy will be controlled when licensing is not required, and to ensure that planning decisions include enforceable occupancy condition to safeguard our communities. Thank you.
Thank you, Councillor Senior Bly.
Through you, Chair, appreciate there's a lot of points there, Councillor Senior Bar. All I can confirm is that we do liaise closely with the planning service, and I am aware that this was raised last week, and the planning service are going to liaise with DFA in relation to the LDP plan strategy, and further evidence is going to be provided in relation to some of the information provided by CRAM, and they'll obviously be consulted in any change to the LDP. But what I would say is, in the meantime, we'll continue to process all applications in accordance with the legislation and liaise closely with planning service going forward.
We look forward for the report and the paper coming.
Thank you, Seamus. Members, item 20 and open for information, licenses and orders issued under delegated authority, and that is Alderman Hussey.
Thanks, Chair. And it's just really a quick query, and it's on the appendices to the report. The two road closures, one requested by council and one by Castle Community Development Association, Newton Stewart. They're past, they've happened. And within those two road closures, was there a need for a traffic management company to be involved in any of those road closures?
Through you, Chair, I'm going to have to check because I really don't know the detail in terms of both the applications and whether there was any supportive documents provided. But I can confirm and send you an email.
I appreciate that, Seamus. And just on a similar basis, is it possible to look at the actual applications? The reason I'm asking that is I know that there aren't that many traffic management companies in Northern Ireland, and if they have to be engaged, they cost a considerable amount of money to organisers of events. So if these two road closures have gone successfully, and to the best of my knowledge, both were very, very successful, and congratulate the organisers of both events. But if they have gone ahead and a traffic management company has not been required, I know of quite a few smaller organisations arranging events who would be interested in looking at the type of application that can avoid having to engage a transport management company, given the exorbitant costs that can be involved.
Through you, Chair, I'm just noting the conditions on the back of this road closure order, and it does refer to the traffic management plan. So you're correct, there's probably a small number of companies that can provide that, but I'll confirm that and I'll come back to you.
I suppose the query is, can a small organisation develop their own traffic management plan without having to engage one of these companies? That's the basics of it, because it's over administration sometimes of what are smallish local events that could be avoided. Thank you.
It's probably worth noting in terms of road closures, DFA roads make the ultimate decision as to whether the road closure is given, and they would look at the traffic management plan in detail. So I just need to double check whether it has to be a company with specific qualifications. So I'll come back to you on that.
Or PSNI on the day, if they consider the road needs to be closed, they have the power to do that as well.
Thank you, Seamus. Thank you, Alderman Hussey. And members, item 21, the Health Survey NI 24-25 report. Item 22, COT Early Frailty Intervention Project, and that is Councillor Duffy online.
Thank you, Aisling, for letting me back in, and thank you for the report. It's good to see the work of COT and the Early Frailty Intervention Project. But I just wanted to say that I met with COT last week. We had a really informative conversation around some of the new programs that are coming up around the EASY program around ASD services within the Western Trust, the mental health cross-border services, and then the community detox as well, and some of the monies that they have received through Peace Plus for those services. There was an awful lot of information in it, and really useful information. So I was just looking to propose that maybe we can get COT in the committee and look at some of the projects and how they're going to be rolled out across our council area in particular, and how our residents might be able to engage with those services. Great work going on, but it's really important that we all are across all the details of it. So I just wanted to make that proposal, Ashley. Thank you.
Thank you, Sandra, and Councillor Devine will second that. I think it's a brilliant idea because there is that much going on and it's all through the Peace Plus money. And if we have our heads around the funding and the projects, then we're able to transfer that information to the residents. So Karen, you'll take note of that. Thank you very much. Members, item 23, correspondence. 24, consultation list. 25, child's rights. Can I have a proposer and a seconder for confidential, Councillor McDade and Councillor Sinoy Barr?